HRT is now called HT, basically hormone therapy, which are drugs which are synthetic, although this day and age most of them are actually plant-based. The only ones that comes from urine of pregnant mares is conjugated equine estrogen, which is not really being used as much. So there are synthetic plant-based hormones which undergo a process of being prepared in labs to mimic the natural existing estrogen in women so that it can be used. And these are made by pharmaceutical companies and labs. There's research about them, and they are regulated, dosage trials, and hence there's been lots of big studies to say this is what happens and combination and risk. So that's what I would call, for lack of a better word, mainstream hormone therapy, which is regulated, which should be by prescription and under guidance. With it comes surveillance, because they work. Some women really need them and it really makes a big difference in certain women, but it must be done by a doctor, clinician who understands the medication, who understands the benefits, understands the risk, and a proper discussion can be held with the woman, and monitoring that comes with it. So not every woman can just take any hormone therapy. Some women shouldn't even take. It's actually more dangerous. Hence, that's why the screening, the assessment, you get diagnosed what your problem is, and the care should be targeted in you, Catherine. For example, what are we trying to achieve?
Right.
What problem do you have? Of the options of hormone therapy, this and this can address these problems for you. This is the benefit you should expect, and these are the risks that come with it. And this is the monitoring that should come with it. That's why it should be a constant discussion, whether annually or as determined according to the individual. The doctor to say, you see me every year, we have a discussion, how are you doing? Do you still need it? Should you stay on it? Should you not stay on it? What monitoring should come with it? And so on. Scientifically, which is a big difference between bioidentical hormone therapy, or normally just called bioidentical hormones. Those are plant-based hormones that are compounded. They're extracted from plants, compounded to mimic the hormones that are present in a woman's body. So in actual fact, bioidentical and the hormone therapy, which is mainstream with pharmaceutical companies, the process of doing them is actually very similar. There might be a difference of the plants that are used, but the so-called natural, they are coming from plants. For me, personally, natural should be, it's what your body is making. Because you're taking something that's not natural to you, it's natural to the plant.
Right.
And as I explained, it's only the conjugated equine estrogen that comes from urine of pregnant mares. The rest are actually plant, even in the mainstream. But the processes of preparing it, hydrogenating it to make it bioidentical means it's been made to mimic and functionally have a similar structure to what a natural hormone in a woman would look like. So that's all bioidentical really is. You're probably referring to the WHO, the women's study and the nurses study. That study did put a big amount of fear, from the hormone therapy having made and changed a lot of women's life, to scaring everybody, to thinking everybody would have cancer, the side effects, the risk was just too high for the benefit, Without going into details of the studies per se, but where we are at the moment is a realization, many studies down the line which have been done on the topic, to show that the initial study, there were flaws of how the study was done, of the group of women that were included in the study, and a lot of them would be women who we would now probably label as late menopause instead of the younger women, and would be women 60 years and up. Where we are today, there is a window, safety window, where commencement or starting a woman on hormone therapy is regarded as a safe window, taking into account that doctor, that clinician has actually done the work of screening the woman, making sure for that woman, for their medical profile, it is safe to be put on any of the options. That window period being between 50 and 60, but a lot of women, as I mentioned, from mid-40s to 60. So starting women on hormone therapy beyond the age of 60 for the first time. I'm not talking about women who sometimes stop and start and recommencement under medical care becomes problematic, because where we are starting it, the timing of starting the hormone therapy in the healthy younger age is best. That's where we're at. And women needs to be screened properly. And a decision from then on be made if a woman is a good candidate from a risk profile point of view to be on hormone therapy to begin with, and what type of hormone therapy would be absolutely contraindicated in a woman and what would be good. And the thinking that every woman will end up with cancer from the flaws of the old studies was that a lot of them were of much mature, much older women who already had a whole list of medical problems.